I'm Dan Collins with Mercy Medical Center in Baltimore, Maryland, and you're watching Medoscopy. Thank you for joining us for today's procedure. Our guests are Dr. Howie Zheng of the Neurology Center at Mercy and Jocelyn Henning, a certified physician assistant and director of Mercy's stroke program. First, a little background. Dr. Zheng, where are you from originally?
Cincinnati, Ohio, from the Midwest.
And you earned your medical degree, though, at the University of Maryland School of Medicine.
That's correct.
Now, for our viewers who aren't aware, Mercy has a long relationship with the university as its teaching hospital for its residents. But, you did head out to Ohio. You did your residency, as you mentioned, internship in neurology, University of Cincinnati Medical Center. So why go there? Why Cincinnati?
At the time, I had a lot of family out there, and it was a wonderful program for training. We would get transfers pretty much from Indiana, Kentucky, and Ohio. So you saw a good, vast variety of neurologic disorders, and it was a big boon in terms of a training resident.
So I'm a terminal baseball fan, so I have to ask, did you get to see any Reds games, or did you...
My first baseball game was actually at the old Waterfront Stadium, and so I've seen a number of them. Now it's, I think, Great American Ballpark. Nice, small, cozy baseball stadium.
Now, Jocelyn, I know you're from Rochester, New York, and therefore you have a connection with Mercy's own Dr. David Main, President and CEO, whose family settled in Rochester in 1974. So like Dr. Main, are you a Buffalo Bills fan or Rochester Red Wing fan?
Yeah, growing up by default, I was a Buffalo Bills fan, as my father is a big fan. Actually met Jim Kelly a couple of years ago, quarterback, in the 1990s. Mm-hmm. And yeah, certainly we grew up going to the Red Wings games, always fun, family-oriented. When I was visiting my in-laws this past summer, we actually had stopped in for a game. And kind of fun fact, Baltimore's own Cal Ripken Jr. played there for the minor league and actually played in the longest professional baseball game, 33 innings.
That's right. There's a book, that tells that whole story, which is, actually I shared a copy of that with Dr. Main because I knew he was a Rochester fan.
Yeah,
You're right. It goes back when Rochester was the AAA affiliate of the Orioles.
Yep.
So that goes back a ways. So you both wound up in Baltimore one way or another, and here at Mercy. Jocelyn, you joined Mercy in 2005. Dr. Zheng, 2014. So you've both been here a bit of a while. Why Mercy and why Baltimore?
So I actually rotated through Mercy as a medical student when I was at Maryland, and rotated through Mercy for a number of rotations. I like the culture here. I like the fact that it's a very collegial work environment, both at that time and even now. And I think that's one of the very important things of any hospital is that, it's nice to come to work and have wonderful people that you can share with and discuss patient care and have a wonderful environment like that.
Now, was medicine something you were both interested in? Always wanted to, a field you always wanted to pursue?
Yeah. For me, my mom was a bedside nurse for, 40 years in Rochester. And like her, like people, like to care for people. So physician assistant was kind of a good middle ground, and it continues to be between a nurse and a physician. So I had always been an interest. So when I graduated high school, I went right into physician assistant 5-year master program, which was nice. And then moved to Baltimore with my husband, who took a teaching job in Baltimore. And so I was looking for a change as well. So moved with him, and like Dr. Zheng had mentioned, Mercy teaching hospital, always learning, and similar values and the mission as my family holds.
So Dr. Zheng, how did you wind up in medicine?
I actually started out as an engineer. So when I was in college, I started out as a chemical engineer and then transitioned to biomedical engineering. Through a lot of summer research, I actually got interested in medicine. We did a lot of cancer research and drug delivery of cancer agents at the time, and my advisor or my mentor in college had actually said, you would be a good fit, and I think as you slowly delve into that realm and you learn more about so much that we still don't know in many different disorders. I developed a love for medicine and eventually started adding on pre-medical requisites to my college curriculum, and then ended up going to med school through that.
Now, why neurology, that particular specialty?
I think the brain is just fascinating, and I think there's a lot of disorders even within the realm of neurologic disorders that there's a lot of room for advances, improvements. There's a lot of things that we are still striving to find cures for or disease-modifying agents for, and I think it's a rapidly developing field.
And in terms, you work obviously with Dr. Zheng, and we're going to talk about the stroke program a little bit later. So obviously you have an interest in this field as well. Why is that? Why did you wind up wanting to focus in that field?
Well, as we know, stroke is very common. And one of the big things that goes back to is educating the public, which I think we'll get to as well. But I really like teaching and kind of connecting with patients in our community on ways that they can prevent stroke or other, diseases such as cardiovascular disease. So working with those patients and ensuring that they understand the signs and symptoms of stroke, along with ways that they can decrease their risk.
Okay, we'll take a break and we'll be back with our next segment of Medoscopy.
Angela Dalzicki is a chronic migraine sufferer. Her headaches are totally debilitating.
Literally laying in bed for weeks and not working. I've lost jobs because of it, and not being able to really having quality time with my children when they were younger.
She tried a host of medications. Nothing worked until she came to see Mercy Medical Center Dr. Howie Zheng. He treated her with Botox, and her life totally changed.
It's unbelievable.
Dr. Zheng says Botox works on migraines by temporarily paralyzing certain muscles.
When people have headaches and migraines in particular, the meninges or the coverings of the skull get irritated and inflamed. In addition, the muscles get to contract in a sense, and they tug on the scalp, producing a version of the pain sensation. With the Botox, what it's geared to do is to kind of mitigate that and to help in terms of relaxing those muscles.
Dr. Zheng administers the Botox with a very fine needle on these parts of the head: the forehead, temples, back of the head, as well as across the shoulders. Patients have these injections every 3 months or so.
The Botox, for a huge number of them, have really changed their life and have given them back what I think is key, is their quality of life and time.
That's exactly what it did for Angela.
I have a complete different perspective on life now. I'm up, I get to have more time, and I have quality time with my children and grandson, so it's a lot better. I'm working, I'm not missing days from the office anymore.
As viewers know, one regular feature of our program is a sort of show and tell, where guests bring in something, some item, could be a book, could be a photograph, who knows? But it's important to them in some way, symbolic of who they are and what they're about. Jocelyn, I want to start with you because I've seen this picture right at me, so I want to know what this is about.
This is my family, my husband of 16 years, together for 21 years, and my 3 children. Alexander is the oldest, he's 11. Adeline is 9, and then Amelie is 4, all born here at Mercy. And, they are my center, my heart. We love to travel, we love adventures, to eat well. And so every day in the morning, I wake up and work for them.
So you had all 3 right here at Mercy?
Mm-hmm. Yep. In fact, I had my son in the Macaulay, the older hospital, as we like to call it, and then the 2 girls in Bunting.
Oh, great. Can I ask who your physician was?
Yep. I go to the Hoffman group, so the girls were delivered by a previous physician who's not here, and then Amelie was by Dr. Mudd, delivered her. Yep.
Nice to keep it in the family, right?
Exactly.
Mercy family.
Yes, yes.
Dr. Zheng, what have you brought with you?
I've actually brought 2 items, and some of them are actually stroke related. So this one is actually a cookbook, a vegetarian cookbook. One of my loves is food, mostly eating it, but I would like to at some point develop competency in cooking at least a healthier meal for myself as well. I think, diet is also one of the very important things in terms of not just stroke, but general health. So the other item is more stroke related, and this is an hourglass. And I think what it represents and what I always tell patients is that stroke is an emergency. And so there is a great need to act fast. As they say, time is brain. And I think this is a great representation to always remind us that if you are having stroke symptoms or stroke-like symptoms, that you should call 911 and act in an immediate fashion as well.
One of our previous guests, you might want to talk to Dr. Jonathan Rich. He's into cooking, so maybe he might have some ideas about some of your recipes there. So, but no, you're right. I mean, people don't, I think, often think that diet is that big of a factor. It's not the first thing people think of when they say stroke. So what should a diet be, in your opinion, for someone who's conscious of that as an issue?
Yeah, I mean, I don't know what the perfect diet is, and I don't know if there is a perfect diet, but I know some of the things your diet probably should not be. And unfortunately, I think that's where a lot of things have turned, right? Diets that are high in sugar, high in processed food, people are cooking less and less, eating less vegetables, more meats, more processed foods, and I think it's important to revert it the other way. And I think in addition to diet, sleep and exercise are probably another 2 items that are very important for general health that I think some people forget.
Do you have a favorite vegetarian dish?
Right now would probably be kale Caesar salad for the summer. So, yeah.
That's a good one. I'm a fan of Caesar salads myself. So. Now, Dr. Zheng, in our break, we had a chance to see your appearance on Mercy's show, The Woman's Doctor, which has been airing on WBAL for nearly 30 years now. And in this segment, you had discussed your use of Botox as a treatment for migraine. Are you still using Botox for migraine? Is that?
Yes. Botox came out in 2010 for approval for use in chronic migraine patients, people who are suffering with multiple high-frequency migraine attacks per month, and it is a very valid and useful, efficacious way of managing and mitigating the number of attacks that people have. We usually do Botox clinic on Fridays. I have had some patients that have been with me and done Botox for years, and it's a technique that even in training, when I was in training, we had started utilizing for people who fail the traditional oral medications. And now even with some of the newer injectables out, not everybody responds to them. So it's another item in the arsenal with the disorder.
Speaking of which, I saw a patient review who said, I started seeing Dr. Zheng over a year ago for debilitating migraines. My medications were changed and I began Botox. I have my life now. Dr. Zheng is the physician that completely understands how bad the pain can be. How gratifying is that?
Yeah, it's always nice to have people that are appreciative of your work, and I think part of it is that it's also nice from a physician standpoint that your patients are now able to have better quality of life, or are able to do their hobbies or spend time with their family as a result. And the patient that you spoke about has been a longtime Botox patient of mine who, like I said, in many cases, she either took oral medications and had poor side effects, whether it's weight gain or cognitive impairment, or failed, with very poor efficacy. And ever since we've gotten her on Botox, we've had dramatic decreases in her numbers.
What I think is particularly interesting is sort of what's behind that last statement. Dr. Zheng is a physician that completely understands how bad the pain can be. When I read that, I think what it means is there's a lot of people say, well, I get migraines. Well, it's just a headache. It's not a big deal. And there's this sense that people often don't really appreciate just how debilitating migraines can be. Do you experience that sometimes with patients who don't think maybe they're being heard when it comes to the pain that they're dealing with?
Yeah, at times. I think what she's referring to is I had shared with her that I had suffered from migraines before as well, and I also had cluster headaches during a period of my life. So firsthand, I know exactly what the pain and the agony of going through those goes through. And I think in a way, yes, it does give you more empathy to the patient and trying to help them.